Sudden unexplained death in infancy. My name is Dr. Carly, also known as Professor Caroline Fertelman, and I've been working in the NHS as a paediatrician for over 3 decades. This used to be called cot death or crib death. The reason the name changed is that lots of babies, unfortunately, will die of unexplained causes, but not in a cot. So the sort of term has sort of fallen into disuse, I think. And it can be called, as I said, sudden unexplained death in infancy or sudden infant death syndrome. And we often don't find the cause. This is particularly the case for the majority of infants who die within the first 3 months. 83% of deaths within 6 months, and the vast majority, the bulk, are within the first 3 months. And we don't really know what causes cot death. We do know that it's associated with sleeping on your tummy, sleeping on your side, probably mild infections. And we know, unfortunately, it's more common in babies who are premature or small. And unfortunately, it's also more common in children of parents who smoke. And there is certainly quite a lot of evidence that that babies who fall asleep on sofas, that's a particularly not a very good place for them to fall asleep. It's definitely associated with falling asleep on the sofa. So please don't let your baby fall asleep on top of you or by themselves, even on the sofa. Sofas are very squishy, and so it's very difficult for babies to always regulate their breathing when they're on a sofa. So there are things you can do to try and help and to follow the sort of safe sleeping positions that I've made videos about, and to try and mitigate against as much as you can. For instance, breastfeeding is protective. We don't really know why, but we know that it is. So there's lots of unknowns in this. There is research being done in this, and I think it's important to know that for certainly the older children, the evidence now is that the more we get advanced in technology, that we do find some of the older children, and certainly many of the children over 1, we may well find a cause if it's not infections or obvious or anything found at the post-mortem, but we may well find that they've got a problem with their heart rhythm. There's a disturbance in their heart rhythm, or they may have undiagnosed and sort of subclinical epilepsy or seizure activity. So those are sort of some of the newer technologies that are helping us work out the causes in slightly older children and older infants, but we still don't really know the cause in little babies. It is rare. In 2019, 196 babies in the UK died of cot death. And as I said before, mostly the younger babies. So please follow the advice and look at the Lullaby Trust. They have an excellent website with lots of very useful resources. If you found this video helpful and useful, please do subscribe to my YouTube channel and tell others about it.